So what is post-concussion syndrome? For that I will have to explain you what is concussion syndrome, and for that I will have to tell you about head injuries. Now I am Dr. Gurneet Singh Sawhney. I am a senior consultant and head functional neurosurgeon at Fortis Hospital Mulund, Mumbai. Now let me first tell you that concussion syndrome is a type of head injury, now which is considered as the smallest head injury that can happen. Now whenever a person has an injury to the head, or the head hits any of the place, any of the wall, or by accident or anything, we define them depending upon the symptoms that happen after that. Now if there is a loss of consciousness, the patient behosh hua, if there is fits or seizures after the accident, if the patient has got any vomiting, or if there is any bleeding from the nose or from the ear, then we consider it as head injury. There is one more thing. If the patient has got amnesia to the event, जैसे patient को वो event जब हुआ वो याद नहीं है, then that is also head injury. Now whenever there is a head injury, we always do a CT scan, and in that we find out if there is any bleeding or not. The mildest type of head injury is called the concussion injury. Concussion मतलब brain अंदर हिल गया. So the brain has shaken inside, and that gives rise to a concussion head injury. In this, the CT scan is absolutely normal. Now, in spite of this concussion injury being the mildest, it gives rise to some trouble to the patient after this injury, which is called as the post-concussion syndrome. In this, patient को सिर दर्द होता रहेगा, और ये सिर दर्द कुछ लोगों का बहुत लंबा चलता है. It goes on for some weeks, months, and sometimes a year. Some people get giddiness or vertigo after the concussion injury. Vomiting feeling, nausea feeling also is a part. The patient's personality changes. The patient gets more irritable, gets angry very fast. Now these are some of the features of post-concussion syndrome. Now there is no major surgical treatment required for post-concussion syndrome. The medicines are usually good enough to control it. There are some of them which takes time for controlling, but it usually gets under control. So don't fear any head injury. Everything is treatable and curable, and we here are able to control and manage all kinds of head injuries, including the concussion syndrome, efficiently. Thank you very much.